Hi, it's me again. So, last time I was teaching you how to breathe using a diaphragm, because this is going to be the basis for learning to be able to relax yourself, and we'll use it in techniques to help you sleep better at night, and also as part of general strategies for managing anxiety. Why diaphragm breathing? Because it's a way of breathing that stimulates relaxation. It's stimulating the vagus nerve, the part of the parasympathetic nervous system that helps to relax you, slow your breathing, reduce your blood pressure, and so on. The opposite to the parasympathetic is the sympathetic nervous system. These are all branches of the autonomic nervous system. It's basically what controls all of your unconscious bodily functions, your heart rate, your blood pressure, and so on. The sympathetic is the one that's responsible for what's known as the fight or flight response. I imagine you've heard of that. So this is where your body gets ready to fight or run away. It responds to your thoughts, actually, whether you're conscious of what those thoughts are or not. It can respond to unconscious thought, and it prepares your body for flight or running away. So it prepares your body for stress, but too much of it does actually leave you stressed and overstimulated. It makes it difficult to relax. So we're learning the breathing as a start to learning how you can relax yourself. Obviously, you will never change the way you breathe, but you can learn to adjust your breathing consciously when you want to. If you've ever observed babies breathing, generally, if they're lying on their back, you'll see their stomachs going out and in, because they're breathing using their diaphragm. It seems that once we get upright, at some stage we start using our chest muscles to inflate our lungs rather than our diaphragms. But using the diaphragm is what will help us to relax. So I gave you a little tutorial last time on how to breathe using a diaphragm. So I'm going to give you a reminder this time in case you have forgotten or just want to check you're doing it right, or you haven't seen the other video. And then I think maybe we'll just say a few words about what's going to come next. So breathing using a diaphragm. Remember, it's helpful to imagine that you're breathing into your stomach, even though you're not, because it's your stomach you want to move, because that shows that you're doing it properly. The diaphragm is the muscle beneath your lungs, and when that moves and inflates the lungs, then it pushes your stomach out. So let's have a go. I was asking you to practice this 3 times a day, and when you do it, just do 4 breaths. That should be enough. But if you do it every day, it's like driving. At first, you have to think about it, but after a while, you can do it without thinking about it too much, because you know what you're doing and your body's trained. Okay, let's have a go. So I'm going to put the hand on the chest, the hand on the stomach again. Okay, just adjust this so you can see that. So let's breathe in, out, 1, 2, and again in, out. Remember to take longer breathing out than breathing in, and pause at the bottom before breathing in again. Out. Doesn't matter if you're breathing in and out with your nose or your mouth or both. And then in and out. But I'm pursing my lips just to help slow the breath down. Okay, and that's it really. The idea of getting you to practice that was so that you can do it whenever you want to. And although we're doing it standing up now, ideally I would like you to practice sitting down when you've got the hang of standing up. And when you reckon you can do it sitting down, try lying down. And once you can do it standing, sitting, and lying, practice without your hands. Now remember, I told you to do it while you're looking in a mirror so you can make sure you're doing it properly. But once you realize that you are doing it properly, you've got the hang of it, don't use your hands, but practice doing it standing up, sitting down, and lying down. Okay? And then that will get you ready to be able to use this in any eventuality, really. And that's what I'm going to talk to you about more next time. The next video is going to focus a lot more on sleep, good sleep hygiene, how to manage your sleep pattern, how to deal with sleep problems. And then we'll move on to managing anxiety and stress and that kind of thing. Okay, well, keep it up, happy breathing, keep practicing, and I'll see you again next week for another video. Cheers, bye.